Louisiana woman is suing the maker of two popular weight loss drugs over the severity of their side effects. Ozempic and Mounjaro have been used to treat type 2 diabetes, but are now being used for weight loss. The woman who filed the lawsuit claims Novo Nordisk and Eli Lilly downplayed the risks associated with the drugs, including gastrointestinal side effects, also known as stomach paralysis. The woman says her symptoms have been so severe she had to be hospitalized and even lost teeth due to excessive vomiting. Both drug makers say the adverse side effects are listed on the prescribed medication. And today we begin a two-part series on the weight loss craze sparked by Ozempic. For years, diabetics lost weight with the help of that medication prescribed for type 2 diabetes. Now, Wegovy, prescribed specifically for weight loss, is the drug of the future, and supplies are dwindling. Today in Part 1, News Nation correspondent Kelly Beeson takes a look at who's getting it and who shouldn't be, and how that's affecting supplies.
It's the miracle drug overweight Americans have been waiting for. That metaphorical magic pill dieters have been looking for to drop the weight without the workouts. But in America, where more than 100 million people are obese and dieting is a $70 billion a year industry, does it work?
It works. I've never seen anything like it.
Ozempic is usually prescribed by doctors to treat type 2 diabetes, not weight loss. But it contains semaglutide, the same active ingredient in its sister drug Wegovy, widely prescribed for obesity. Studies find the once-weekly injection can help users shed up to 15% of their body weight, even more with a moderate diet and exercise.
This medicine to me is now a tool that is better than any tool that I've ever had before as far as helping my patients, because I've seen patients lose weight comparable to when they've had patients to go get the surgeries.
But who's getting it? And is the drug going to the people who need it most? According to FDA guidelines, the medicine is for people living with obesity, those with a body mass index of at least 30 or a BMI of 27 with additional health issues like diabetes, high blood pressure, or kidney disease. But not everyone who uses it needs it, and that's contributing to supply shortages for many patients taking Wegovy for obesity and Ozempic for diabetes. The worldwide popularity of the drug sparking huge demand at home and abroad, sparking questions too around just who's getting it, like slender people, including celebrities.
There's a big pushback as far as physicians are being discouraged from writing the medicine for people with lower BMIs, and what we're talking about now are celebrities. Is very common. Some of these celebrities might have a BMI as low as 22 or 24, and they just want to get a little bit more attractive for their movie role. Well, in the medical community, that's being considered now as unethical.
If they're not overweight, how are they getting it? That's because some doctors are writing prescriptions for Ozempic and Wegovy off-label, in other words, for reasons other than diabetes and obesity, and it's completely legal.
Once the medicine is on market, meaning that it's available for physicians to write, if they want to write the medicine for something other than what is FDA approved for based on their clinical judgment, they can do that.
But do the benefits outweigh the risks?
Do the benefits outweigh the risk? Well, Kelly Beeson will have that answer. Monday, we'll take a look at that and the side effects. Are they worth it? As the makers of two weight loss brands face a lawsuit over severe side effects. We've got more in part 2 of that series on Monday. Still ahead, a Russian oligarch, a tech